Hello, this is Dr. Sean McWilliams from Disc Centers of America in Alpharetta and also the Atlanta Spinal Correction Center. And what I'd like to talk to you today, just for a minute, is a pre and a post MRI on one of our patients who came to us who was really suffering a lot. She was out of work at this point. She was in her 40s. Unfortunately, she had chronic low back pain. She was having pain going down all the way down into her leg called sciatic pain. She was losing the ability to control one of her feet called foot drop, which is a major issue, and also had lost her reflexes. She was out of work at this point because of this pain that she was dealing with. She didn't want to have back surgery. She didn't want to have injections to kind of just put Band-Aids on it. So she came to us seeking help. And so what I'd like to do is I'd like to review her pre-MRI and show you her post-MRI. We do post-MRIs on our patients because we expect to see the disc be able to control and contain itself. We're looking for better hydration into the disc and a reduction in the size of the disc so that we know that the disc is actually getting healthier and we're not just numbing it. So let me show you her pre-MRI to begin with. So when she came in, she had a massive disc herniation here at L5, also very large disc herniation at the L4 level, the L3 level, and the L2 level. After working with her doing computerized spinal decompression therapy, which is incredibly comfortable, this is her post-MRI after approximately about 3 months of care. And you can see the major reduction in the size of the disc herniation at L5. L4, L3, and L2 are almost non-existent, which is really nice for 3 months. If you really know what you're looking at and you look at an MRI closely, you can see the difference in the darkness or the lightness of the discs. The darker the discs are, the less blood supply and the less hydration that's happening to the disc. And so when you go and look at her 3-month post-MRI, you can see the differences in the color of the discs. They're actually getting lighter, and that's a great sign for her because we know that we're getting more blood supply into the disc, we're getting more oxygen into the disc and better nutrients, and able to get rid of waste products so the disc can actually start to heal itself from the inside out, not just go and get cut on, where it winds up usually having an issue 3 to 5 years later because you never really got the disc to be healthy again. So at this point, this young lady was back to work full time. She had no more low back pain. Her sciatic pain was gone. She had almost full control of her foot function and her reflexes were normal again. So I love being able to share stories like this. We have a lot of them. So if you're suffering with chronic low back pain, if you know that you have a disc herniation, perhaps spinal stenosis, a disc bulge, if you're having the pain going down into your leg, any of those type symptoms, I want you to remain hopeful. There are some other possibilities. Computerized spinal decompression is non-invasive. It has an 88 to 91 to 92% success rate. In our office, we sit at 90% success rate for our patients, which is very high compared to surgery and epidural injections. And if you have an MRI or if you have images of your spine, set a consultation up with us. I offer my consultations at my expense. You can come in and talk to me. We'll review your MRI with you, make sure you fully understand it, and if I think spinal decompression or some of the other therapies we have will be helpful for you, I'll let you know that. And if not, I'll be honest with you too, and I'll get you to the right people. So if you're suffering, call us for a complimentary consultation. We're here to help you. We have some amazing tools that most offices don't do, as well as certifications on all of these. We're board certified. I have 4 national certifications in doing spinal decompression for all those different conditions, so call me. I think I can offer you some hope. Until next week, here's to your health, Dr. Sean McWilliams.